When a child is unresponsive and not breathing, or only gasping, it is critical to begin CPR right away. CPR consists of 30 chest compressions followed by 2 breaths. In this video, you'll first learn how to give effective chest compressions. Then, you'll learn how to give breaths using 2 different types of breathing barriers. And finally, you'll learn how to put together chest compressions and breaths to give CPR cycles. Compressing the chest and allowing it to fully return to its normal position moves blood-carrying oxygen to the brain and other vital organs. First, ensure that the child is on their back on a firm, flat surface, such as the ground. If they are lying on a bed or couch, move them to the floor carefully. Next, kneel beside them like this, with your knees near the child's body and spread about shoulder-width apart. Place the heel of one hand in the center of their chest, with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compressions. When giving compressions, push hard and fast. Compress the chest to a depth of about 2 inches and a rate of between 100 and 120 compressions per minute, or 1 about every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few compressions so you can see what they look like. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. For a small child, you may only need to perform chest compressions using one hand instead of 2. When using one hand, be sure you're able to compress the chest about 2 inches. Simply place the heel of one hand in the center of the chest and give compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14. Giving breaths supplies oxygen to a child who is not breathing. Studies have shown that breaths, in combination with chest compressions, increase a child's chance of survival and minimize brain injury. The risk of infection while giving breaths is extremely low, and data show you will most likely use your training for your child, family, or friends. However, a CPR breathing barrier, such as a face shield with a one-way valve or a pocket mask, can further lower your risk of infectious disease. These devices protect you from contacting saliva and other body fluids and from breathing the air that the person exhales. If available, you should use a CPR breathing barrier to give breaths. However, do not delay breaths to find a breathing barrier. While giving breaths improves a child's chance of survival, please remember, if you're unwilling to give breaths, you can give compression-only CPR. A face shield is a flat piece of thin plastic that is placed over the child's face with the opening over the child's mouth. It has a valve that you give breaths through without making mouth-to-mouth contact. First, place the face shield over the child's face, ensuring the one-way valve is over their mouth. This is the most important step when using a face shield. Then, open the child's airway using the head tilt chin lift technique. Put one hand on the forehead and 2 fingers on the bony part of the chin and tilt the head back to a slightly past neutral position. Next, pinch the nose shut, take a normal breath and make a complete seal over the child's mouth. Then, blow into their mouth for about 1 second and make sure the chest begins to rise like this. Allow the child's chest to fall and the air to exit while you take another breath, make a seal, and give a second breath. This is what it looks like put together. A pocket mask is a transparent, flexible device that can be sealed to the face, covering the child's nose and mouth. It has a one-way valve that you give breaths through without making mouth-to-mouth contact or inhaling air exiting from the child's lungs. When providing care to a child or infant, it is essential that you use appropriately sized equipment to ensure that you can make a good seal. Some pocket masks are one size fits all for adults, children, and infants. In this case, follow the manufacturer's recommendation for use. For example, according to the manufacturer, you may rotate the mask so that the narrow end fits over the child's chin. In other instances, separate pocket masks are available for use with children and infants. First, place the mask at the bridge of the nose like this, and then lower it over the child's nose and mouth, making sure it doesn't go past the chin. Now, seal the mask by placing the space of your hand between your thumb and index finger at the top of the mask above the valve and your remaining fingers on the side of the child's face. Then, place the thumb of your other hand along the base of the mask and place your bent index finger under the child's chin. Lift the child's face into the mask and open the airway to a slightly past neutral position by tilting the head back. Gently but firmly hold the pocket mask in place to form and maintain a good seal so air does not leak out of the sides when you give breaths. Now, take a normal breath, make a complete seal over the mask valve, and give 2 breaths. When you give a breath, maintain an open airway in the slightly past neutral position, being careful not to push the head down. Watch as I demonstrate. Remember, each breath should last about 1 second and make the chest begin to rise. Pause between the breaths to allow for their chest to fall and the air to exit. When giving breaths, the chest should begin to rise. However, you might encounter a situation where the chest does not begin to rise. If the chest does not begin to rise on the first breath, reopen the airway and give a second breath. If the chest does not begin to rise after reopening the airway and giving a second breath, an object might be blocking the airway. That is, the child may be in cardiac arrest due to choking. You will learn about caring for an unresponsive child who is choking in the choking module. Now it is time to put the skills you have just learned, giving chest compressions and giving breaths together, in order to give cycles of CPR for a child. Each CPR cycle consists of 30 chest compressions followed by 2 breaths. Remember, it is important to begin each CPR cycle with chest compressions. However, if drowning is the suspected cause of cardiac arrest, deliver 2 initial breaths before starting CPR cycles. Also, make sure you smoothly transition between chest compressions and breaths. Interruptions in compressions to give breaths should be as short as possible, taking less than 10 seconds. Okay, now watch as I put chest compressions and breaths together to perform 2 cycles of CPR. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You should continue to give CPR cycles until you notice an obvious sign of life, like breathing, an AED is ready, another trained responder is available to take over compressions, EMS personnel arrive and begin their care of the child, You are alone and too tired to continue, or the scene becomes unsafe.